It's doctors versus government in Rajasthan. While protesting against the right to health bill, doctors were lathicharged in Jaipur.
पुलिस जिम्मेदार होगी क्योंकि इन्हीं की वजह से हमारे डॉक्टर्स को पीटा गया है। हम चाहते हैं कि सरकार इस बिल को अभी की अभी वापस ले और जो भी पुलिसकर्मी इसमें थे उनके खिलाफ सख्त कार्रवाई की जाए।
More than 27,000 doctors have been demanding to roll back the Draconian Act. But what's the Right to Health Bill Act? Ashok Gehlot-led Rajasthan government became the first state in India to introduce a Right to Health Act. In many ways, this is a landmark legislation as it makes access to healthcare a legal entitlement of every resident of the state. Under this law, neither government nor private hospitals and nor the doctors can refuse a person seeking emergency treatment. The burden of reimbursement will be on the state government. But private hospitals and doctors in the state are up in arms and are on an indefinite protest against the government.
हम पीछे नहीं हटेंगे। सरकार अपनी मंशाओं के लिए हमारा यूज़ करना चाहती है, ये गलत है। हम पहले से ही फ्री सर्विसेज दे रहे हैं, तो फिर इस आरटीएस कानून का कोई औचित्य ही नहीं है। ये सिर्फ जनता को बरगलाने के लिए लाया गया विधेयक है, जिसको हम बिल्कुल नहीं चाहते। रोल बैक आरटीएच।
The protest has also left the patients in a lurch.
समस्या हो रही है, आप 2 घंटे 3 घंटे से बैठे हैं, बहुत ज़्यादा हालत खराब है, पेशेंट नहीं देखो ना।
So why is this bill contentious? The law makes it compulsory for the private sector to provide emergency treatment in areas where government hospitals cannot provide the service. One of the biggest objections by the private hospitals was over who would be reimbursing the cost of free treatments meted out to the patients. Another contention was over likelihood of more bureaucratic interference in the private hospitals and their operations. For any violation under the Act, a hospital or doctor will be liable to pay a fine of Rs 10,000, which increases to Rs 25,000 for subsequent violations. Many doctors want the law to be implemented only at government hospitals and not the private hospitals.
आरटीएस से क्या होगा कि कोई भी इमरजेंसी बता के हॉस्पिटल में जाएगा और फ्री ट्रीटमेंट की डिमांड करेगा, फ्री एम्बुलेंस की डिमांड करेगा, तो आगे चल करके इससे डॉक्टरों और मरीजों के रिश्तों में बिगाड़ होगा और एक ये गलत अध्याय शुरू हो जाएगा। धीरे धीरे चल के पूरे ये जो चिकित्सा व्यवसाय है इसका पलायन शुरू होगा और राजस्थान में कोई भी चिकित्सक जो है कोई भी अपना हॉस्पिटल नई इंडस्ट्री आना बंद हो जाएगा।
Let's look at why this bill is crucial. For the Ashok Gehlot government, the passage of the bill will be important ahead of approaching assembly elections. Not just this, Rajasthan alone saw 19,114 cases of road accidents in which 16,769 people were injured and 9,000 lives were lost. As per the proposed Right to Health bill, no private hospitals can deny treatment to such victims, even if the patient does not have the money to pay for it. In fact, not just road accidents, but other emergency cases such as snake bites will also be under the purview of this bill. So what do you think about this bill? Let us know in the comments below.
For more informative videos like this, keep watching India Today News Mo.